Hello, and welcome to the Evelyn Y. Davis Studios at the National Press Foundation. Today we're talking about investigative reporting on psychiatric hospitals with the winner of NPF's Carolyn C. Mattingly Award for Mental Health Reporting.
The National Press Foundation is a nonprofit dedicated to helping journalists cover complex topics with depth and accuracy. We serve journalists in the U.S. and around the world.
I'm Sandy Johnson, president of the National Press Foundation. With me today is Rosalind Adams, an investigative reporter for BuzzFeed News. She has also reported for the Center for Public Integrity, ProPublica, and the Miami Herald. Rosalind is the winner of the National Press Foundation's Carolyn C. Mattingly Award for Mental Health Reporting. Congratulations, Rosalind.
Thank you so much.
So your project beat out 56 other entries. Tell us where the story idea came from.
So the story really just came from first looking at the annual reports of different hospital companies. I had been interested in mental health institutions. I've done some mental health reporting in the past. And when I was reading UHS's annual report, their legal proceedings section immediately stuck out to me. It was 2 to 3 pages long. They had disclosed that a number of their hospitals had been subpoenaed. There was some sort of federal investigation going on that was pretty vague, vaguely described in the report. So I really just started with the question of what is the nature of this investigation? What's going on at these hospitals? Are patients being harmed potentially? And just started asking questions from there.
Mm-hmm. Now, was this the company's annual report or reports to the SEC, or tell us a little bit more about the documents?
Yeah, it's this particular document was the company's 10K, the annual report that they file with the SEC. And in there also, they had described that a couple of the institutions that had received subpoenas had been referred to the criminal division of the Department of Justice. And that's where I started my reporting. I started with a couple hospitals in Florida, reaching out to former patients and employees to just try to figure out basically what was happening.
So you reported on this project for a year. Over that time, how many people did you interview?
I interviewed about 300 people. Part of the difficulty of the story was UHS has so many hospitals. As I mentioned, I started my reporting in a Florida hospital. Mm-hmm. But from there, there was a question of how widespread is this pattern of holding patients until their insurance runs out, and to get at the different departments of a hospital, to get to the administration, to get to patients, admissions departments, and confirm things within a number of hospitals. It just took scores and scores of interviews.
Mm-hmm. And how did you find employees to talk to? I know you talked to a range of former employees as well as current employees.
Yeah, so I really use basic tools like using LinkedIn to find former employees. I used Indeed.com. They also have resumes online that you can search. Also when I was looking for former hospital administrators, I created a spreadsheet of hospital administrators of all of UHS's hospitals using tools like the Wayback Machine, because usually a hospital will put their administrator on the website. So you could search back and see former administrators. I use LinkedIn again. Hospital directories often would list CEOs, and you could get those for a number of years.
So the Wayback Machine, for people who don't know what that is, can you describe it?
Yeah, so the Wayback Machine, it's basically an internet archive, and it allows you to search older versions of a web page. And if you just type in Wayback Machine to Google, it comes up. But yeah, it was a great way to see older staff. Some of the hospitals, they would put administrators and then, their chief medical officer, nurses, therapists on their websites. And if you search older versions of the website, you could see people who had left those positions. So that was a really important tool for the story. And then also, I really didn't reach out to current employees while I was reporting. It was usually I'd reach out to former employees and ask if they still knew people that worked there, if they had friends that might want to talk to me. A lot of these places that you're reporting on, they're just like any other workplace. They keep in touch with old friends. It's like you're sort of breaking into a subgroup. So all those tools are really important to finding people.
Did you tape the interviews as you went along, or were you just keeping, text notes?
I did both. I definitely kept a lot of recordings. I think especially in the beginning of the reporting process when I was learning about how these hospitals worked, like I didn't, there was a big learning curve. I didn't understand how a patient necessarily moved through the hospital, that they started admissions, then techs are on the floor with the patients, and then they see the doctor, like sort of the very, very specific ways that a hospital works, a psychiatric hospital works. It was important to I kept recordings and very detailed notes just to piece that all together.
Mm-hmm. Now, before we move on, tell us how you kept track of 300 plus interviews. What sort of system did you set up so that you knew what you had as you went along and when you finally were writing?
I used a lot of Excel spreadsheets. I'm sure people have way more sophisticated ways of doing this. I kept like a Word file for every interview, and then I would keep Excel spreadsheets of like all the people I had tried to contact, and I would keep a different page for like I'd contact people by their position. So I'd have like a list of all the admissions people I had tried to talk to, or all the insurance coordinators, or all the nurses, or all the therapists that I had tried to coordinate. So I could just see who I had tried to reach out to, who hadn't called me back. And then I had another master Excel spreadsheet of just every interview I had done. And that was incredibly important just because it was like name, hospital, position, and then I just used a field for like keywords and like major points of the interview. So that way, when I was writing, I could go back and sort that spreadsheet by, okay, I've talked to this many of this position, this many in this hospital, keywords to remember the interview. When I was going through fact checking, I think there were probably 60 or 70 interviews that were extremely key still. So it was a lot to keep in your head. You're trying to remind yourself of everything that you've learned as much as possible.
Mm-hmm. Let's talk a little bit about the commitment process, or how people are admitted to UHS hospitals. What did you learn about that?
So it does vary a little bit. I found that in more rural hospitals, like one of the hospitals that we focused on in the story was Millwood Hospital, or the Colorado one. There are some hospitals that will rely more on advertising different free assessments for people. And so sometimes a patient will walk in, they'll want an assessment, they're not feeling great, they're having some sort of struggle, and they'll get an assessment. And then in that process, a counselor can evaluate them and say, oh, we would recommend you for inpatient treatment. And in some of those times, you could be put on a commitment hold. And that the laws vary state to state. But sometimes that could be a 24-hour hold. Sometimes that could be a 72-hour hold, depending on if a counselor evaluates, and then ultimately a doctor evaluates you as a threat to yourself or others. In a lot of more urban areas, I found there's people being transferred from medical hospitals that have been committed already. And they're mostly like receiving transfers, but they've also been committed in some way.
Mm-hmm. And I suppose we should actually tell our viewers, what was the outcome of your investigation ultimately? What did you discover about UHS and its practices?
So what I discovered was that there was an immense amount of pressure on these hospitals to meet their financial goals and to keep beds filled. Um, and in the process of doing that, so when a person comes into the hospital, um, and their insurance company approves them for a stay, they will approve them for a certain number of days of treatment on the outset. And what I found in a number of these hospitals was that there was pressure on the doctors to keep the patients until their insurance days ran out. And sometimes people do need more days than that. Sometimes that treatment isn't sufficient. But sometimes a patient is struggling and, they may stabilize more quickly than the number of days they're allotted. Ultimately, a doctor at the hospital is supposed to determine when they're supposed to leave, not an insurance company, but there was pressure on doctors to keep patients at the hospital until their insurance ran out. So that was the outcome.
And how did UHS grow from a small player to a behemoth? It seemed like it happened like in the 1990s.
Yeah, in the 90s. Actually, what was really interesting about this story was when I was learning all this, there was a similar thing that had happened in the early 90s. There was sort of for-profit mental health care came about in the 80s. In the early 90s, the four biggest players in the industry all had billing fraud issues, very similarly to what UHS is under scrutiny for now, where they were holding patients until their insurance ran out. At that time, insurance coverage was a lot more free-flowing, like people would stay a month, like stays were much longer. But in the face of all these federal inquiries and lawsuits, a lot of these companies collapsed in the early to mid 90s because of these fraud issues. And UHS slowly really just began buying up these companies that were that had collapsed, and really the biggest thing that happened was they had a pretty big competitor where they were about equal size with in 2010, their name was PSI.
PSI?
PSI, Psychiatric Solutions. And in late 2010, UHS absorbed them, and then UHS really became the dominant player because they acquired about 100 hospitals around that time.
And how many facilities do they have overall, and how many patients do they typically care for in a year?
They have like 218 behavioral hospitals, and they treat thousands of patients a year that cycle through all these facilities. Some of these facilities, they're all freestanding psych hospitals, most of them. They also include residential treatment centers and rehab facilities in their behavioral hospitals. But yeah, some of these may be 50 people, but 100 or more. So thousands of patients a year.
In UHS, there are facilities in almost every state, is that correct?
Yeah, there are facilities in 37 states, so they're all over the country, really. And the other thing that I found was the UHS doesn't brand their facilities in any way, so, a lot of patients didn't necessarily know that they were walking into a UHS facility. And after the story published, I got a lot of letters and emails that were like, oh, I didn't even know this company owned the hospital that I walked into, and then I checked. So that was one of the things we made sure to do as part of the story, was publish like a map of the names of the facilities, where all they were, so you knew sort of what company was behind these hospitals.
So journalists in 37 states essentially can take the roadmap, if you will, that you laid out and look into UHS in their own states.
Yeah, definitely. I think it's a really important trend that's happening now of journalists partnering up and following up on each other's stories. And there's a lot of reporting to do on these hospitals.
And how much of UHS revenue comes from taxpayer funds like Medicare and Medicaid?
About a third of it. It's a huge percentage. I do think that's a big part of why the federal government is interested in these hospitals. If there are fraud issues. And yeah, they're hugely reliant on older people and people on disabilities who have Medicare, and Medicaid doesn't cover. Medicaid covers a lot of the kids in their facilities because it covers psychiatric care for kids.
And tell us about your reporting methodology. I guess you work through CMS, Centers for Medicaid and Medicare?
Yeah.
Their data?
Yeah. That was one of the really important things that I had gotten a tip on about how they were coding things. So that was hugely important to the story. I mean, one of UHS's sort of company lines is it's really impossible to write a story about our company because all of our facilities are run independently. Our CEOs are independent. We're a very hands-off company. And in the reporting process, I found that really wasn't very accurate. CEOs are under a lot of pressure about their budget from their supervisors, and the fact that the coding was so specific or so similar in all these hospitals really showed that they were doing things similarly across their hospitals. The other thing that was really important from CMS was one of the things I requested was the underlying complaints. So CMS will go in and do surveys of these facilities to check for safety issues, to check for quality of care issues, and people can write in complaints, and employees can make complaints also, and sometimes they'll do a survey based on a complaint. And in the process, so I requested the underlying complaints for those surveys.
Is that the term? Underlying complaints?
Yeah. I think the terminology that I used was just any complaints for these facilities that had driven the surveys. And one of the things I got in one of these records requests was a letter from the central CMS office to one of Florida's CMS offices saying they needed to investigate River Point, which is one of the Jacksonville facilities that's in the story, because there had been allegations of holding patients for 10 days, holding patients who didn't need care. So, I mean, what was really amazing was that there was an active investigation going on, which government don't typically comment on ongoing investigations, but I had then a document that outlined some of the allegations that were happening as part of this investigation.
Let's talk a little bit about the patients and their families. And I know we have a clip from Samantha Trimble, who I guess was in the facility in Arlington, Texas, the Millwood Hospital. So maybe we can run that clip.
Sure.
That it probably actually was.
I made the comment, it's Texas, it's not that hard to find a gun. Never in my wildest dreams would I have imagined that joking comment would be the absolute crux of why they thought they were going to hold me against my will. I was walked down a long hallway where you would normally see what I thought was doctor's offices, and they weren't. That it was hospital rooms. At that point, I realized something wasn't right. I kept saying, I'd like to access it, I'd like a second opinion, I'd like to leave. I called the police. I asked them to let me go, to let the police officers see the paperwork. They wouldn't tell them anything. They wouldn't tell me anything.
So how did you find Samantha Trimble?
So Samantha, I actually found her because she posted a Google review about Millwood Hospital. She had obviously had a very terrible experience at Millwood, and she was very vocal about it, and she really wanted people to know what was happening in these hospitals, or in Millwood, And she posted on Google, I have a federal lawsuit against this facility. If anybody else wants to talk to me, if they've had similar experiences, please reach out. So I called her, and we spoke for over the course of the year. I found her because she was so public about what she'd gone through. We spoke for a very long time. And there was, of course, like a very long process of, getting her deposition transcripts and her medical records and the police report that was just in the clip, in order to verify the story and verify that it was similar to what I'd heard from employees elsewhere. But I did find actually that Yelp and Google could be great ways to find patients, just because they're a very unfiltered way for patients who feel like they have no power to reach out and say something and reach other people. A lot of these, Samantha was very unique in the fact that she filed a lawsuit. A lot of these patients, they may feel like they were held unnecessarily, but, private lawyers don't always want to take these cases. They're very difficult to prove. The malpractice, it's not exactly a typical malpractice case in the way that, if somebody gets injured in the hospital, it's because they're being held against their will. It's hard to sort of quantify the damages of that. So people looked for I found that people looked for other ways to sort of get their experiences out. And sometimes if you can go on Google and Yelp right now for some of UHS's hospitals, and you'll see complaints of, I was held against my will. So it was, in many ways, the story was sort of in plain sight. I think we don't always feel like these patients have credibility, that we can listen to them, but, we certainly can.
And I know that Samantha had talked about suicidal thoughts before she checked into Millwood for an interview. Can you describe the suicidal intent that was cited on federal claims by UHS and Medicare and Medicaid, I guess?
Yeah. So the way the commitment laws work is you can be held against your will if you are a threat to yourself or others, and the language varies state to state, but the idea is you're supposed to be an imminent threat to yourself. It's supposed to be like a very active threat. And one of the things that admissions workers told me was that if they got any indication that somebody had ever had a suicidal thought, they could twist that and make it so they seemed more like a threat than they were, and use that to hold somebody. And sometimes that came down from pressure because they were trying to meet numbers, they were trying to get a certain number of people in the hospital, or if they had more open beds at the hospital, there was more pressure on them to do that. But so somebody like Samantha, she denied that she was suicidal. She said that she had made a comment about having thought about suicide once. And it was written down on her admission paperwork that she was suicidal. And several admissions workers told us that sometimes they would ask questions in a certain way designed to get somebody to discuss suicide. One of the examples that I heard several times was, have you ever thought about suicide? Or if you have thought about, or if you were to commit suicide, how would you do it? Which is incredibly manipulative, because no matter how you answer, somebody could write that down and say, oh, look, they have a plan to commit suicide. So there is supposed to be, it's not supposed to just be that you have a suicidal thought and then you can be committed. There is supposed to be some sort of intent. There's supposed to be some active threat. So admissions workers are supposed to look for intent, a plan, a number of different factors to really evaluate how much of a threat somebody is. It's not supposed to be just, I once thought about suicide and you get held for that. And that was really Samantha's experience. She felt like something she had said was taken out of context. And other people that I spoke to felt that way as well. Mm-hmm. And that was why we looked at the code for suicidal ideation. We found that it seemed to be that they were exploiting sort of a gray area. So if somebody had suicidal ideations, obviously a Medicare code doesn't you know, doesn't get at how much of a threat they are, but it's a way that they can express to their biller, this person is a threat, they've had suicidal thoughts. When in reality, the process of evaluating somebody about how much of a threat they are is much more complex than that.
And how did you reach the conclusion that UHS was using the suicidal ideation codes much more frequently than other mental facilities?
I worked on the story with our data editor, and he did an extensive analysis of the data, and there was just a very clear pattern that they were consistently using it, and they had been increasingly used it. They used it way more than their competitors, and it really stuck out to us as a UHS practice.
I'd also like to ask you about family advocates. We have several more examples I want to go through, but let's say you go into a facility, you wind up, they're keeping you there, you think against your will. What can a family member do to try to get you out under those circumstances, or are they as helpless as the patients themselves?
It really is ultimately up to a doctor. I did find in my reporting that patients who had advocates who were, who had like husbands or parents calling and asking questions, like those people were usually released sooner, or they were released as soon as like the 72-hour hold is up. Often these commitments last for 72 hours. But I do think having an advocate matters a huge amount. And these were also people who felt like something wrong had happened to them, and they were very vocal about that. And those were usually the people that didn't have advocates usually stayed longer, just anecdotally. That's what I found consistently.
So we're talking with Rosalind Adams about her award-winning journalism looking at psychiatric hospitals. If you have questions for us, tweet at us at NatPress. So Rosalind, let's turn to the documents that you were able to shake loose from government agencies, courts, police. Can you describe some of those?
Yeah, so I think one of the things that was really important about the reporting process was, as I mentioned before, mental health patients, they often don't have a lot of credibility. And the claim that we were hearing that patients didn't necessarily need to be there, it's incredibly hard to prove that. And especially because once a patient is already in the psych hospital, they are sort of already deemed, oh, they're crazy. There's probably some reason why they're there. And a lot of patients did have reasons why they showed up, certainly. So one of the things I looked for was any sort of other way that any other contrary evidence that showed that a patient didn't need to be there. So, for example, in Samantha's case, the police report was incredibly important. Samantha, again, from the beginning, felt like she didn't need to be there. She was calling family. She called the police herself because she didn't feel like she didn't need to be there. She felt like the hospital was violating the law. And so the police report was like, it laid out that the hospital wouldn't let the police officer see the records. The police officer didn't think that she needed to be there either. And certainly you're just looking for any sort of discrepancies in what the hospital has written and what somebody else has written. So those were extremely important.
Did you have to FOIA those, or were they simply available?
Police records, yeah, you have to request them. But often Samantha, in this case, gave me hers. The other thing that was really important to this process was building relationships with the people that you're reporting on, because when you're reporting on somebody's mental health history, you can't just FOIA the records. Mm-hmm. They have to request them themselves. And so you have to build a lot of trust with people in order for them to take the time to request their own records, and for them to trust you to go through their mental health records. So that was incredibly important. There was another character in the story, Allison, who within her mental health records, the doctor had said she's not she's not an active threat to herself or others. Like we should release her. And she had also felt sort of tricked in this intake process. So it was always incredibly important to get people's mental health records too.
Let's talk about another example. This involves a 6-year-old boy in Jacksonville, Florida. So what was his situation?
Yeah, that was a follow-up story that I wrote. There was a 6-year-old boy who had been acting out in school, and in the process of him acting out, the school had called the police on the boy to Baker Act him. Baker Act is the name for Florida's commitment law. And so the police took him to one of UHS's facilities in Jacksonville, River Point. He stayed there for several days, and the hospital's point was, well, somebody else Baker Acted him. We didn't Baker Act him. But the point of the Baker Act is if there's possibly a threat to yourself or others, they should be taken to a hospital for evaluation. So the hospital is still supposed to evaluate whether this boy is a threat to himself or others. According to his parents, he had never had any sort of, severe he had behavioral issues, certainly, but he was never had shown to be an active threat to himself or others. I think he was hitting other kids. And even his medical records really just showed that all he was being a 6-year-old boy at the facility. And in the process, he's 6, he's put on this adolescent facility with much older kids. His nose gets bloodied. He has to go to the hospital. He's placed in seclusion. It's really unclear if he needed to be subjected to that at all. So in Florida, at the end of the 72 hours, you can file a petition to extend the commitment process, and the hospital decided he needed to stay there longer. And that was the point where the parents were just like, what is happening? This is absolutely not what our son needs.
So the hospital petitioned to keep him for, was it 90
for
days?
Yeah, so it can be up to 90 days. Usually it wouldn't be that long, but they would have the authorization to do that if the petition was granted. And the public defender stepped in and eventually got the boy released. But I had heard a lot before that story ran just about how much pressure there was to use the commitment process in Florida to hold patients longer, because if they're filing these petitions, then that gives them legal authority. So that was one of the allegations in this complaint from CMS, that they were exploiting this commitment process in Florida. And when I heard about this example, the 6-year-old boy, it just seemed so clear how this hospital could be exploiting this process. There was no way that a 6-year-old fit the criteria to be held that long.
You've talked a little bit about how laws vary from state to state, including the well-known Baker Act in Florida. Where can journalists go to get information on their state laws pertaining to these issues?
They are, they're pretty easy to search online. If you look for commitment laws in your state, you can read the statute. There are some mental health advocates that have organized, a spreadsheet of every law by state. But I did find that reading the actual statute's really important, because you can see what the language is. Like in some states, it says imminent threat. And it can be a little bit looser or more strict on how it is to hold people. So I always tried to make sure I was familiar with the state statute, especially reporting on a national organization, just because it varied.
Did you work with any of the advocacy organizations? I know there are many, for throughout the mental health community.
Yeah, I really didn't. Actually, even I think I called like a few. I mean, I called a few to get sort of insight into the laws and things like that, but not actively. And yeah, it wasn't even this wasn't really on their radar. It wasn't an issue they were looking at. I think a lot of the story about mental health is usually that there's not enough funding and people aren't getting treatment, and that is absolutely accurate. I'm not here to say that's not accurate. But unfortunately, I think in the course of these private institutions trying to maximize revenue, sometimes people didn't always need treatment who were there.
Mm-hmm. Let's go to your example in Tulsa, Oklahoma, involving Shadow Mountain Hospital. And what did you discover there?
So that story was a follow-up that came after the original story. One of the things that was so rewarding about the story was after we published the first big story, hundreds of people wrote in and, either said, I've had an experience like this, or thank you for writing about this. And also a lot more people wrote in with tips. And so somebody wrote me about this, actually, I think 5 people or something wrote me about this hospital in Oklahoma. And one of those sources had a surveillance video that they had obtained from the hospital that they had been concerned about because the CEO of the hospital was sort of personally restraining kids. And it was unclear if he had been trained to do that. Usually administrators aren't putting their hands on kids. Usually it's floor workers or nurses are supervising. I spent some time in Oklahoma talking to the employees there, going over this footage, and there were definitely serious safety issues there. There were riots at this facility. The CEO was very hands-on. He's now under investigation by the state for what's in the videotapes. And we, again, heard the same allegations from physicians and clinicians that there was pressure to keep people there until their insurance days were up.
Mm-hmm. And I know there's a line in your story that this particular facility, there have been 340 calls from the hospital to the police. What was the nature of those calls?
So that was that's always a tool I request when I'm trying to learn about a hospital is I'll request from the local police department the calls for service. I think especially in this case, because it was largely a children's facility, and in Oklahoma you can't get police reports for minors.
You can?
You cannot.
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 Okay.
But I could at least see a spreadsheet of the call, the date, and the nature of the call. Some of them were fights, some of them were abuse, some of them were, there were a few rape incidents, there were a lot of runaway incidents, and that was just sort of one cursory way to get a sense of what the facility was dealing with.
Mm-hmm. And did you check both police and sheriff's records or just city records?
I think in this case I just checked like the Tulsa Police Department.
Local police.
Yeah.
And let's talk about the surveillance videos that you were able to obtain.
Yeah.
How were you able to spring those?
So that came from a source. I think. So I really learned the value of sourcing relationships on this story, just because these places are so secretive. They're private. They are behind locked doors. You cannot just walk into one of these facilities. But the people who have worked in there, the people that have had concerns, they have much better access to things than you do. So a source shared them with me, and of course it took some time to not only verify them with other employees and through other incident reports and things like that, but also showing them to experts to see exactly what I was looking at. I think it's true as well that restraints and seclusion never look great. So experts were really important in this process to talk about the techniques or why this might be safe or unsafe.
And during this long reporting process, you reported for more than a year, correct?
Yeah.
Was there an aha moment where you thought you had just really nailed some details through documents or insurance or video, that helped you as you were beginning the writing?
Yeah, so actually I wrote the story like a lot. And I sort of wrote it as I reported. And that helped just because there's so much material. So I wrote like the first draft, probably more than 6 months before the story came out. And that just sort of helped me process through the information that I had just because I was getting so much information and organizing the material. But there was one draft where I wrote, and I turned it into my editors, and they were like, they were happy with the draft, but they were also like, this pattern that you're seeing in all these hospitals is so clear. It's certainly, they're like, it's very clear that there's a company-wide pattern here, just because you're hearing the same language at all these hospitals. Like, see if you can get somebody to confirm that this is coming from the corporation. And I really wasn't sure I was gonna get it. And what I did was, at that point, that was when I made a spreadsheet of every CEO I could find in all of their hospitals for the last 5 years. And that was what I talked about earlier by going through the Wayback Machine, mining LinkedIn, mining old hospital directories, and in the process came up with a spreadsheet of about 75 former CEOs of these hospitals, because what I found just in learning about how the company was organized was the CEO of a hospital has the most direct link between the corporation and of course, like maintaining the budget for the hospital. And yeah, I made my way down that list of 75 CEOs. And in that process, I got 3 of them to confirm that they were instructed by regional executives to, they call it use all the days on the table. And that's sort of this coded language that I had been hearing at hospital after hospital. And that really meant if an insurance company gives you 5 days, make sure you're using those 5 days. You don't want to leave money on the table. That was sort of the language around it. And so once I got 3 executives to confirm that this was coming from regional executives who work for the corporation, it wasn't just a rogue CEO. It wasn't just one hospital. This was really something that was coming down as a strategy for them to maximize profits.
And indeed, their compensation was tied to this strategy, correct?
Yeah, that was also something that I got from a source who shared that with me, and that was it was extremely there. There was one cache of documents that I got. Internal documents that I got from a source, because again, this is a private company. You can't request those sorts of things. And in that sort of trove of documents was the annual compensation plan. And yeah, it showed that, if you meet your budget, you could make, depending on how much you exceed your budget, you could make an additional 125% of your salary. So the incentives there were extremely clear. At that point, I had interviewed UHS already, and the way they always sort of phrased it to me was the compensation plan, yes, we have bonuses, but it's based on a range of factors. And when I actually got the document, it was very clear that the primary amount of bonus that these executives are getting is based on how much they're exceeding their budget by, or their annual revenue goals. So it was very clear that it was incentivized to maximize revenues at each hospital.
We have a question from a viewer who wonders how you built trust with the people you were talking with.
Honestly, that was just A lot of time. I always make myself really, really available to sources. I'm always like, here's my cell phone, call me whenever, anytime, text me. I'm very sort of casual. I text sources, I call them. I do think also this really hadn't been reported before, and there were a lot of people that really wanted to share their story. So I can't take all the credit. But I think people were really looking for an outlet for to explain what they were under. I think especially because UHS is so big, a lot of employees were, even if they wanted to leave, they felt like they might end up at another UHS hospital just because they own so many facilities. And so there was a lot of fear there. But at the same time, there were a lot of people who just felt like what they were seeing was wrong. And they wanted to share that with somebody. So, yeah, a lot of it was going slow, taking time, trying to show up in person when I could, and just sort of legitimately taking an active interest in what was happening.
Mm-hmm. And when did you approach UHS, and how did you go about getting comment from them?
So that was pretty interesting, actually. I think traditionally in investigative reporting, there's sort of this process of you sort of gather all your material in secret, and then you go to the company, you say, I have this information, I'd like to talk to you about it. And because of the way that I was reporting, I was just calling so many people. Like I was, I would say probably for every 10 people I called, I'd get a pickup or somebody would talk to me. And they, of course, maybe 1 out of 10 didn't even necessarily want to talk to me. So because I was calling so many people, UHS actually reached out to me, and they were like, we know you're working on a story. What can we help you with? And they reached out to me, I think in February, and the story came out in December. So I had been reporting for a few months, but I certainly didn't have any sense of the shape of the story at that point. And, I went back and forth. I think they gave me like a statement. And I was very general with them just because I really didn't know like the main findings at that point. And eventually, had a sit down interview with them in May, and then another one in November. And they were, I have to give them credit for, they did sit down with me. They provided me a senior, executive for me to interview about what was in the story. And I was very open with them from the first sort of sit-down interview. This is what I'm hearing. What's your response? This is what I'm hearing. This is what's your response? They were certainly didn't agree with what I had found. But actually, I do think that part was probably unique for most investigative projects.
Mm-hmm. And so what they ultimately provided was a 9-page document that you put on the website.
Right. So after... we really made sure to be as transparent as possible with what we were publishing. I think in part because the findings were so shocking. Just even as a reporter on the story, going through it for a year, it was shocking. And so after those 2 sit-down interviews, before we published, I sent them a long letter of every single point in the story, and they provided an equally long letter in response, I think, yeah.
Mm-hmm. And ultimately, UHS set up a website to counter your findings.
They did, yes. So actually, while I was reporting on the story, I got a call from somebody who had left the company, who had sort of alerted me to the company's strategy to combat the story, which was extremely interesting and enlightening to see sort of the other side, like the PR campaign that goes on to combat journalism. And that's why it's in that main story, because I had been alerted to it by a former employee. I got an email that was like, I've known you've been working on this UHS story for a while. Everybody's at the company is really nervous about it. Call me, or so, like something very cryptic like that. And the person who had knowledge of sort of what was happening at the company shared that they had built a dark website. They had hired an outside PR strategy campaign. They hired Edelman PR to develop a campaign for them. And they also hired outside counsel as well. And they were very aggressive as well throughout the story. So while I was going back and forth with the company and setting up interviews, I also got a number of letters about my reporting process from their lawyer. So there was a lot of communication with UHS throughout this story.
Mm-hmm. And your story went through legal review internally at BuzzFeed, correct?
Yeah.
Can you describe that process?
Yeah, we have amazing in-house counsel, and it went through extensive legal review. We just made sure that every single point had sources and documents behind it. Some of the language got changed in the process, and we made sure to disclose everything to UHS. So because UHS was also sending us a lot of letters, there was one point in the reporting process where a source had given me internal documents, and I was going door to door, asking people about the documents, and UHS found out and sent me a letter that I had violated trade secret law, for example. So they were sending a number of letters sort of attacking my reporting process.
Intimidation.
Yeah, definitely. And so it was very important to the story that it was extensively legaled, yeah.
And let's talk about the impact of the project. So first of all, what happened with the company's stock?
So in the sort of first week after that story came out, the company lost a lot of valuation. I think it was $2.5 billion in valuation. Investors certainly expressed concerns. In a sense, the stock has recovered, certainly. But there certainly are still concerns among investors about how the company is being run. The way that the company is set up is the board has a lot more voting power. So their annual shareholder meeting was just last week, and there's some concern that investors they don't really have control over what's happening in the company because of this multiple class voting system. That's still ongoing. The federal investigation is still ongoing as well.
It's the Department of Justice. Can you tell us a little bit more about the investigation?
Yeah, I actually have a story coming out, I think today or tomorrow, a little bit more about the investigation. But in the process of reporting, I did confirm that the investigation was looking at similar things as what the story found of whether patients were being held too long. So that I don't have any sort of insight into how far along it is. I know I've run into people that they've interviewed a lot as well in the process of just interviewing so many people. It remains to be seen what the outcome will be of that.
And politicians also were interested in your story, correct?
Yeah, Chuck Grassley has been very adamantly asking for information on the investigation.
That's Senator Charles Grassley
Yes.
of Iowa.
Yes. And then after the Oklahoma story came out, he's been asking the Joint Commission, which they're the accreditation body for hospitals, about how a hospital that's having riots and safety issues could still maintain its accreditation. And he's also been put pressure on the OIG, which is the Office of the Inspector General for Health and Human Services, to brief him on the investigation as well.
And has that happened to your knowledge?
I know that sort of the active part is confidential. They briefed him on some of the closed parts of it. Certainly the more people, I think, making inquiries about what's happening here, we'll get to the bottom of what is happening.
We have another question. A journalist is asking, how long did you spend working on this particular investigation, and were you working on other stories at the same time?
So I do have the luxury of working on the investigations team at BuzzFeed. So we are all working on long-term projects. I was primarily working on this for more than a year. but yes, so I don't have beat reporting responsibilities, which is really nice, and I can just really burrow into these stories. There were many long nights of just like dialing people over and over and over again, but it really. But it's to BuzzFeed's credit that they're investing in a team that just does long-term stories. So I'm really lucky to work there.
Mm-hmm. And was there any other impact that journalists should be aware of? Whether political or financial, criminal?
No criminal so far. The criminal investigation is ongoing. There's an investigation into the CEO at the Oklahoma facility that I recently wrote about. And yeah, I mean, I think ultimately, probably the biggest impact will come from any results of the investigation, just because they have far more power to fine or bring charges against anybody.
Okay, and we're running out of time, so any final thoughts for journalists who want to go down this path of investigating private institutions?
I mean, it's hard, but it's worth it. If you find the right people, you can really get a window into something that nobody else is looking at. I mean, the sort of thing I think that I found surprising was there's this that nobody had written about UHS before. It's hard, but it's certainly possible to get into these private institutions, to find sources that will turn over documents, who will whistleblow about bad things happening. You just have to start asking questions.
Well, and that is one of the things that really struck the Mattingly judges, was how unique this topic was.
Yeah.
None of them had ever seen stories about private psychiatric hospitals, that's of nationwide impact. So our thanks to Rosalind Adams for sharing her tips and best practices for reporting on mental health. You can find more resources on mental health reporting on NPF's website at nationalpress.org. Thank you.